Good afternoon and welcome to Trib Talk, a production of the Salt Lake Tribune. I'm Nate Carlisle, a reporter who's been covering the pandemic these last 6 months. We are here this afternoon to talk about college football, or lack thereof. The conferences representing Utah's college football teams have punted on a season for fear of outbreaks among the teams. Only Brigham Young University plans to play in the fall. There is some discussion that Utah, Utah State, Weber State, and SUU could have a season in the spring, but there's big doubts about that too. With me today is the Salt Lake Tribune's University of Utah beat writer, Josh Newman. Josh, welcome.
Thank you, Nate. How are you?
Yeah, I'm as well as any American these days. Also with me is Dr. Peter Chalmers, a physician with University Healthcare and a physician for a number of athletic programs at the U, as well as the Salt Lake Bees. Pouring a little bit of my cinnamon roasted almonds out for those guys this season. Welcome, Dr. Chalmers.
Thank you so much for having me. I'm glad to be here.
Thank you. Let's start with the basic question. Why is the Pac-12, the Mountain West, and the Big Sky not having a season when other sports leagues figured out a way to do it? Dr. Chalmers, you first, please.
I think that's a great question. I think the difficulty here is not whether or not anyone has figured out how to do it, as much as it is the fact that we don't really know what the risks will be. And it may very well be that the sports leagues that are planning to proceed may not proceed as cleanly as they would like. Certainly, we've seen that with MLB's start as they've had travel and they've had outbreaks. And we're going to see the same thing in college football. Will it be to the degree that we'll be shut down? I don't know. But I think ultimately that unknown has led the Pac-12 to make a decision for the safety of their athletes and the safety of their families. And I think we have to respect that decision as much as everyone else wishes that we had some football this fall.
Yeah. Josh, go ahead and tell us what you've heard in your reporting. What are the explanations you've heard for why the Utes, Weber State, et cetera, aren't having a season this year?
Yeah, well, there's definitely different agendas, being that those are different levels of college football. At the Pac-12 level, that medical advisory board was very clear a couple of weeks ago that, in their opinion, it is unsafe to play college football at this time. And the Pac-12 presidents and chancellors they did the right thing. They took that advice and they wiped away the college football season, at least for the fall. And I agree with it. Now, I do find it interesting that, the Pac-12 and the Big Ten, which also postponed, are thinking one way, but the rest of the Power Five, the SEC, the Big 12, and the ACC are continuing to plan to at least start, their season on time come September.
BYU, which is an independent and thus doesn't have a conference, and they're proceeding. And I do want to talk about that later in the show. We should add that at one point we had the Utah State University athletic director scheduled to appear here. He had a conflict and had to back out. But we will try to have some discussion of what's going on at Utah State, which is very much like the Utes, that the Aggies have had to cancel their season with the rest of their conference. Let's move on a little bit. We've heard about bubbles. It's become one of the catchphrases of the pandemic. And it's been said that the bubble wasn't feasible for college football. Dr. Chalmers, I'm wondering, do you see a bubble any more feasible in the spring if the schools decided right now that's what they were going to do?
I think that's a great question. And certainly as we've watched the NBA progress and how effective their bubble has been for preventing outbreaks, I think everyone is wondering how can we replicate that for other sports leagues? Because sports is important. It'd be really nice for us to be able to return to more normal times. I think sports provides people with hope and entertainment and a little distraction from everything else that's going on right now. There's a lot of issues at stake. One of the issues is that the number of the resource, it's so resource intensive for the NBA to do what they've done. It's so expensive that it's hard to replicate. And they have a pretty unique setup because there's a limited number of athletes. And I think that's probably one of the critical things is there's a limited number of athletes that all can be co-located for a period of time. Even when the MLB discussed it, it's hard to find the right number of fields in a certain location. Like the MLB discussed doing this either in Orlando or in Phoenix, where there are the right number of fields. to replicate that kind of thing. And even the MLB decided it was not feasible for them to do. So if it's not feasible for us to do with a league like the MLB, or the resources they have, it's hard to foresee it happening for college football, especially given the number of athletes, the amount of playing space they would need, the amount of time they would need to be co-located. But I do think that there's a lot of lessons we can draw from the bubble. And there's a lot of things that the NBA succeeded at where you can say, clearly isolation works. And if we could take some of those lessons and incorporate them into protocols, it does make you think maybe we could replicate some of that, maybe not quite to the same strictness, but on a larger scale for college football in the spring.
I mean, the universities already have, lodging on campus, some of which is not being used during the pandemic, because they're trying to keep people separated. I mean, could a bubble theoretically work if we said, okay, we're going to put all of our players in the dorm and keep them isolated? Is that why is that not an option? And also, what other logistics are involved here? Because I think a lot of people assume, you hire someone to push the swabs up the noses, a couple times a week, and you're good to go.
Yeah, I mean, I think the testing is one aspect to it. I mean, the NBA has invested heavily in testing, and we are really lucky in Utah here that we have incredible resources for testing. I think one of the things you can say about Utah's response to the pandemic is that we've tested at a higher rate than many other states. And I think it's one of the reasons why things are the way they are right now. So I give real kudos to the folks that have put a lot of efforts into that. So that's one piece. And I think we could accomplish that here at the University of Utah, but it's hard to know if we could accomplish that across the league. One of the things about the bubble that I think has been really notable is how strict they've been with those players. I mean, you've seen, for instance, even recently with Mike Connolly leaving the bubble and then having to self-quarantine before he can come back in, even with just that small exposure. So everyone's recognized that it really only takes one person to bring the virus in. And if you're not testing, then all of a sudden it can spread, and your bubble might as well be the outside world. So I think that's really hard to accomplish with collegiate football players. I think everyone recognizes that it's, although our kids are committed to football, they're probably not committed at the same level as NBA players. There's a larger number of them. There's also the aspect of how much of their career it's been so far. There's the aspect they have to go to class, they have to interact with their classmates. So I think that it's just harder to envision the same thing on a collegiate football level. But I do think that you could envision us getting closer to it and maybe getting back to it in the spring, of course. Yeah.
Okay, so maybe some kind of modified system like Major League Baseball is doing, or something like that could be. Okay. Josh, what about you in your reporting? What do you see as the likelihood there would be Utah football in the spring, and what factors are at play there?
Yeah, certainly things are changing every day, and it is uncharted waters for everybody. And we're all trying to find our way, from the reporters to the Pac-12 officials. At this point, I would say spring football in the Pac-12 is probably worse than 50-50. And part of that is just conversations around the league. Before this Trib Talk began, the beat reporter spoke with Kyle Whittingham, and Kyle made a good point. He, the 2020 season, whether it's fall, spring, whatever, it's already impacted. What you don't want to have happen is you don't want to also impact the 2021 season. So, you have one impacted, you don't want two impacted. So to his point, he thinks that if you're going to play spring football, you have to cut it off at 8 games, maximum 8 games, in order to preserve a full on-time 12-game schedule in 2021. Now, on a smaller level, to get any sort of spring football played, the virus has to get better, much better, in some of these Pac-12 strongholds, right? California has been a problem. The state of Arizona has had trouble. Well, that's not good, because between California and Arizona, those two states house half the Pac-12. So for starters, you need to see, the cases drop. You need to see better testing protocols. A lot of things have to happen between, I would say, now and Christmas or the end of the calendar year to even hope to have a spring football season in, late February, even into early March. Okay.
And then Josh, go ahead and tell us about the financial impact of losing the college football, that the schools, as we said, they already lost the NCAA tournament, which provides a big chunk of their annual budget. So now where are these schools? What kind of cuts could we see?
Yeah, college athletics as a whole, especially at the Power 5 level, it's all tied to money. It's all about money. And it became apparent pretty quickly going all the way back to March, as you said, with the NCAA tournament revenue that wasn't there. It was clear that if no football was played, there were going to be some dire financial ramifications, specifically in terms of TV money and media rights money that comes in. I believe Pac-12 schools at this point are getting somewhere in the neighborhood of $35 or $37 million annually just from the TV networks. So from a Utah perspective, they are projecting, with no football at all during this fiscal year, they're projecting losses between $50 and $60 million. And sadly enough, that's sort of on the low end of Power 5 football. Oregon is looking at more of 80 million or so. Nebraska, which is in the Big Ten, is set 120. Ohio State, also in the Big Ten, they're talking about 120, $140 million in losses. So dire economic ramifications with no football. And if you're looking at losses like that, specifically at Utah, people are going to get furloughed again. People are going to lose their jobs, unfortunately. We already know that Mark Harlan, the athletic director, and Kyle Whittingham, and Larry Kristoviak, the men's basketball coach, those three are three of the big money makers inside that athletic department. And they have agreed to give some money back and take a salary cut to try to keep things rolling here. The good thing that the Pac-12 has opted to do is, and it's not set yet, but the Pac-12 is getting ready to offer its member schools very large loans up to I believe it's $80 or $82 million at a small interest rate over a number of years to, for lack of a better term, to try and keep the lights on at these different athletic departments. So we're going to see what happens with the Pac-12 loans, but either way, again, as we predicted, going back to mid or late March, dire economic times right now for the Pac-12.
Let's expand statewide a little bit. There's some schools in Utah have cut certain athletic programs because these losses of revenue, right? What have we lost already so far?
Yeah, there hasn't been a ton statewide. Southern Utah, which plays in the Big Sky, their operating budget is somewhere, $15-17 million during the fiscal year. So they cut both tennis programs, some other non-revenue sports. Utah State, which, again, we're talking about much smaller operating budgets, no big TV money coming into the Big Sky. Utah State has been able to avoid much in the way of furloughs and layoffs and cutting sports. Dixie State down in St. George, which is a first year Division I program. They have also, with a small operating budget and no TV money, they have also avoided things of that nature, layoffs and furloughs. So will that continue? We don't know, but it's not going to get any easier. It's not going to get any better if these schools don't play football.
I have one question for Dr. Chalmers, and we're going to go ahead and start taking questions from viewers. If you have a question for Josh or Dr. Chalmers about this football season, or again, lack thereof, go ahead and send those in, please. You can tag us on Twitter with the hashtag Trib Talk. I believe you can also send a question into on our Facebook page right now. This is being broadcast live on Facebook. Dr. Chalmers, every college football team these days has a half dozen to a dozen players who are 300 pounds. And we know that obesity is a big risk factor for complications from the virus. And I mean, even if you are 6'5", if you're 300 pounds, you probably meet the technical definition of obesity, right? So has that come up with you and your peers about how there might be a very specific cohort that's at risk in college football? And what have you and your colleagues said or advised about this?
That's a great question. I think the first thing you said is totally true, that there's definitely been shown to be an association between risk of serious illness with coronavirus and obesity. And that's probably because largely this is a respiratory illness. And definitely there are respiratory consequences to being overweight. I will say that the caveat to that with this specific cohort is that our definitions of obesity are not perfect. So most of them are based upon this ratio of height to weight that is used to this formula called the body mass index. And those numbers provide technical definitions for overweight, obese, et cetera. And those numbers are not perfect in very muscular individuals. In fact, they're known to fail in very muscular individuals. Most of the individuals you're talking about, while they may meet the technical definition based on a height to weight ratio, would not meet a more medical definition for risk for obesity because most of that weight comes from muscle mass. And that's where things get a lot more complicated for defining. And oftentimes that's used in terms of looking at lean muscle mass, and that you just need something more complicated than a scale to actually measure that. Okay. I think if you want to talk about the risk here, the risk is really that we play college football and we create an environment for an accelerated spread of the virus in that population of players. That those players, they travel between schools, they bring the virus from school to school. After the game, they interact with their classmates, they spread the virus to those classmates. Some of those classmates interact with teachers that are at real risk. They interact with janitors that are at real risk. They interact with support staff at the university. They interact with their families who are at risk. So I think when we talk about the issue here, we frame it as one of player safety, and I think that's important, although rare. What we're really talking about here is trying to socially distance so as to reduce the spread of the virus to at-risk individuals who will eventually encounter it at a higher frequency if we play football. So I think that's the real balance, and that's a hard thing to measure. And that's the reason why this is so hard, and the reason why different sports leagues have made different decisions is because it's hard to put a number on that. And it's hard to put a number on how much of that there would be or how much it's worth to anyone. But I really respect the Pac-12's decision here. And I think ultimately when we talk about it, that's what we're talking about. We're talking about not necessarily those players, but all the people they would interact with and spread the virus to unknowingly, unwittingly, not purposefully, who could then become seriously ill and die.
We do have a question from Corey on Facebook, but I think you just answered this. Is community spread a legitimate concern in college football? And it sounds like you just answered yes, right? That the concern is not just whether the 18 and 19-year-olds catch this virus, but whether they pass it to coaches, to staff, to professors, et cetera. I mean, that's one of the big worries if you let the seasons play, correct?
Oh, absolutely. That's the major concern. And there's been some research on, could we design a face mask so there's less respiratory passage? And the problem with that is that ultimately the air has to be directed. When you breathe out, the air has to go somewhere. So if you restrict the flow too much, I mean, as you know, these are highly aerobic activities, and you can create aerobic deficits if there's not enough oxygen transfer. So that's one of the concerns. I think the bigger concern is that football is played at close proximity. That's just the way the game is. And at close proximity, you're just much more likely to spread the virus from person to person. And that some of these players may have it and not know it. That's just the nature of this particular virus and the way it's affecting us. So I think that's the main risk here and the main thing we worry about. Some sports are less of a concern for that. So like gymnastics, for instance. Gymnastics is an individual sport where in between each trial, you could wipe down the surfaces. The players could be distanced from one another. You could do that in a safe way. Mm-hmm. Basketball is not, and that's the reason why you've seen them be so specific. Even in baseball, you could envision ways where they could play it maybe more safely, although it's really hard. Even baseball is a very athletic activity where you are in close proximity, but football is among the worst in terms of respiratory spread.
Yeah, that's why golf was probably one of the first leagues to restart, right? Yeah.
Exactly. Yeah.
Let me ask you quickly about BYU, and I don't know if you've given any advice to BYU, but we just talked about community spread. You live in this state, Dr. Chalmers, so if there were to be an outbreak because the Cougars are going to play football, that could theoretically impact you. Do you have any particular concern about BYU going forward with its football season?
I respect their decision, and I think that makes every institution must do what makes sense for them. I will say that in my daily life, and I think in most of your listeners' life, they should do their part to try and prevent the spread. And I hope that our institutions will try and do the same. but I don't think it's within my purview to tell BYU what to do.
Okay.
I just think that this is one of those things where everyone should do their part, because this is temporary, and at some point we're going to have a vaccine, or we're going to have a better solution. And if we can do things that will try and prevent the spread so that fewer people die, we should do those things.
That's actually a good lead into the next viewer question we have. Emailed in from Max. Will this change how fans attend football games in the future? I assume that this is the virus. I've seen some reports that the conferences that are going to go ahead and play, they're going to allow a limited number of fans into their stadium. And whether we see football again in Rice-Eccles Stadium, Dr. Chalmers, in 2021 or later, are we going to be packing 50 and 60,000 people into that stadium again, in our lifetimes even, or do you foresee going to have to change? Okay.
For
go
sure.
ahead.
For sure. The timing as to when, it's hard to know, but I certainly think that that's going to be in the future, that we will go back to the way things were in terms of sports. The harder thing is going to be, there's going to be some patients that will, some people, some viewers that will be nervous. So I bet even if you were to open the stadium now, it would not be full, because there's a lot of people that would worry and who should be worried about that kind of gathering right now. But again, this is temporary, and I think that in the long run, things can go back to where they were at Rice-Eccles.
Okay. Josh, we can talk about Rice-Eccles for just a moment, because there has been a construction project on the way, undergoing at Rice-Eccles, and it seems that's continuing. Now that they know there's not going to be football there this fall, does that change anything for the construction projects there? I mean, they're going to go ahead and do things maybe they wouldn't have done this schedule previously, or what do you know about that?
Yeah, no, absolutely. The football stadium, specifically the south end zone, there's a big project going on there. They were ready to demolish the south end zone, which has the locker rooms. They were redoing the whole thing. The capacity with that project was going to bring it from about 45,000 to about 51,000. And the one silver lining here is that with no football, that project is now 4 months ahead of schedule. They weren't going to do the south end zone until after the season ended. Now there is no season. They began demolishing it yesterday. So athletic director Mark Harlan started talking about that last week. So they're ahead of schedule. They're on budget. So they still expect that to be ready well before the 2021 opener.
Yeah. We should point out that one end of that stadium is going to be renamed I think it's the Garf Family Performance Zone.
The Ken Garf Performance Zone.
Ken Garf Performance Zone. The son of, the sitting patriarch of the Garf family was Bob Garf, former Speaker of the Utah House of Representatives, who was one of the first coronavirus deaths in the state. So I don't know if you call that irony, but it's definitely a relevant footnote into that construction project. Maybe just a note on how it doesn't seem like anything's gone untouched by the virus. Let's move on to these athletes that aren't going to have a season. Josh, it was determined this just here a couple of days ago that they are going to be able to have, basically 4 years of eligibility, just kind of with what do they call it, a gap year? Go ahead, explain that, Josh.
Yeah, so essentially the way it really works is a student athlete at the Division I level has 5 years to play 4 years of their sport. What essentially is happening now is the NCAA, in trying to help out the student athlete who has been affected by this pandemic, they are freezing the eligibility clock. So really, instead of 5 to play 4, you now have 6 to play 4. Now, with that, there's a new set of questions. The scholarship limit for FCS football, you're allowed to have 85 kids on scholarship at any given time. Well, now if you're freezing the clock, that means, for example, Utah has 17 seniors on its football roster. So you're going to have more than 85 kids on scholarship. next year and probably into 2022 as well. So what's going to happen is the NCAA is going to keep the scholarship limit at 85, but any senior who is coming back next season to finish out their career, those seniors for at least next year are not going to count towards that scholarship maximum of 85. But then there comes into question all sorts of things to do with recruiting. Football recruiting, it's a puzzle. You have X number of players at this position, so you need to go recruit X more to create a depth chart. So that's a question that really we don't have answers to, how recruiting is really affected by this whole thing. And again, we spoke to Kyle Whittingham this morning, and he is as good as anybody I've seen in my career in terms of football coaches with the depth chart and putting the puzzle pieces together in terms of recruiting. Kyle Whittingham has no idea what he is going to do with the 21 and 22 classes. So recruiting, add that to the list of just dozens of questions that we all still have.
Dr. Chalmers, let's shift gears a little bit. Can you go ahead and tell our viewers your work with Major League Baseball and explain to them the role you've had there?
Yeah, so I've worked really closely with the commissioner's office to try and understand, in this time as we try and have a new season with a different schedule, how do we make that schedule so the players don't get injured? So a lot of my research is focused on preventing injuries. I've said often that my goal is to make it so nobody needs to come see me, that they would not get injured to begin with. And in baseball, there's one of the things that's great about baseball is they have great data. They've collected data for decades. And they were kind enough to share that with us so that we could develop some recommendations for how to make their schedule to make it so that in this altered time, as they try and return to the season, they can play without getting players injured. And that included things like, what climates do we play in? Because we're playing at a time of year we're not normally playing. Included things like, how many doubleheaders can we have? How much time do we need to have between games? How many players do we need on the roster? And we've worked really carefully trying to develop recommendations. And my hope is that those kind of things will keep players from getting injured, which I think you've seen already in the NBA. There's been major concerns with players coming off that are a little rusty, jumping immediately back into it. And we've definitely seen a string of injuries that you worry about. The secondary concern is about the spread of the coronavirus among players and the effects that the coronavirus might have. Certainly, there's been a lot of discussion about that. Are there some lingering effects from a performance aspect, and do we need to worry about those, and how do we account for that? And I think that that's going to be with us for years to come, understanding the long-term effects of this virus and how it's going to influence in the future. The people who have the virus who recover, are they different? Are they the same? How do we understand that better?
What lessons do you see for college football in the successes and failures of those leagues that have already restarted?
I think that one of the lessons is that social distancing really works, but it doesn't take much of a screw up for it to fall apart. That it really is links in a chain. It just takes one link to be broken for the whole chain not to be able to hold its tension anymore. So I think that's going to be hard for football. And I think that lesson is going to hopefully be taken into account by athletic directors and those that work under them when we try and design college seasons so that we can keep our players and those that they contact safe.
Okay. Our time's just about up. So I'm going to ask both of you for a prediction. Give me a college football prediction, either for those teams that have said they're going to go ahead and play, or for those teams that have said they're not playing in the fall. Give me a prediction for them. Go ahead, Josh, you first.
Yeah, of the Power 5 leagues that are opting to play, again, the ACC, the Big 12, the SEC, I do think they will continue to move forward. They will start their respective seasons, but they are not going to get through a full season without some sort of interruption. You're already seeing spikes at Alabama and North Carolina and Texas Tech this morning reported a big number of positives inside their football program. So while they're going to push forward, I just don't see it happening cleanly and without some sort of problem at some point along the way.
Okay. Dr. Chalmers, what about you?
I totally agree. And I think that it's going to interrupt conference play. And there's going to be a lot of debate and questions about games that should have been played that weren't played, and how we account for that, and the standings, how we account for that, and who reaches the playoffs. I think for the teams that haven't opted to play, that it's going to be a big question as for the springtime, and all that depends on what happens in the next 3 months. And if in the next 3 months there's a vaccine that's released and it's safe, then I think there's a real possibility that those players all get vaccinated in their spring football. But I think that that's relatively unlikely based on what's happening right now. And I think if we don't have a vaccine, it's going to be hard for the Pac-12 to go back, because as you mentioned, we don't want to impact next year. And I think next year is looking like by then things probably will be better.
A lot of predictions the last 6 months have started with the phrase, if in the next 3 months. Okay. All right. We're out of time. You have been watching Trib Talk, a production of the Salt Lake Tribune. Thank you, Josh Newman and Dr. Peter Chalmers, for joining me today. Everyone stay healthy and please watch out for the next Trib Talk.